I'm going to start with a different story, which is playing a piece of music on my viola. But I'm going to ask you not to applaud, because this is just a different way of telling a story. And I'd like you to invite you actually to all stand up and stretch for a moment. We've been sitting for a long time, and great. When you're all ready, if you could sit down and put your feet on the ground and find yourself grounded. You can listen with your eyes open or closed, and I'm going to be playing the Allemande G by Johann Sebastian Bach.
Can't help ourselves.
Let's just reflect for a moment about what we experienced together. I'm going to ask a series of questions, and just think about them to yourselves for a moment, and then I'm going to give you a few minutes to talk among yourselves and share your feelings. So what did you see? Or if you closed your eyes, what didn't you see when you were listening to the music? And how did that affect the way that you're responding? Did you notice your pulse? Did you notice your heartbeat? Could you feel the blood going through your veins and your arteries when you're listening to the music? Did you notice that perhaps you started to breathe in time to the music? Or did your breath slow? Did you just sigh and get some of the oxygen in and out of your system after such very, very moving talks today? And finally, what did it feel like sharing this experience with each other? And so now I'm going to give you about 2 minutes to share this experience with each other. Just turn to your neighbor and just talk a little bit, maybe about all these wonderful performances and talks that we've just had, but also about the music. All right. Now, I understand there's a reception later, and so we'll all be able to continue after this. But I did want, is the mic on? Okay. All right. We have a reception coming up, so keep these thoughts, because we've got lots of sharing to do, and I think all of us are creatives here, and so there's lots that we can talk about from this. But Dr. Albert Schweitzer, who was a doctor, humanitarian, musician, theologian, and also specialist on Bach. He wrote 2 books on Bach. He said this: joy, sorrow, tears, lamentation, laughter. To all these, music gives voice, but in such a way that we are transported from a world of unrest to a world of peace, and we see reality in a new way. Music can heal. Music heals the individual. It touches all of us. It also heals the musician. It heals those of us who are musicians and healers. And it also can heal the community. So I'd like to talk about these 3 things a little bit today. The close association between healing and music is not new. The Greek god Apollo was actually the god of healing and the god of music. And in this depiction, he's leaning on the staff of Aesculapius, who was his son, the god of medicine, and on top of that is his lyre. Next to him is Dr. René Laennec, who was an 18th century French physician, and he's credited for having created the first stethoscope. He carved it out of wood, and it was initially, before we had the rubber tubing, it was initially a long cylinder. But Laennec was also an accomplished musician, and he knew how to make those tubes because he carved his own flutes. So what is it that music does? How does it heal a patient, even while also healing the healers? How does it touch our hearts? The late Oliver Sacks, who's one of the fathers of this field, wrote this: "The inexpressible depth of music, so easy to understand and yet so inexplicable, is due to the fact that it reproduces all the emotions of our innermost being, but entirely without reality and remote from pain. So we can feel and understand, but we're not directly involved in it." I think the arts all do this. We can transfer a lot of our emotions into the arts and understand ourselves better through the arts. Sacks put it even more simply. He said, music is simply part of being human. Thanks to Dr. Sacks and others, and thanks to new technologies, there's an accelerating interest in bringing the worlds together, and this is what Bill has been talking about, and JD as well. We're sharing knowledge across disciplines now, between the scientists, the caregivers, the music therapists, and it's all for the benefit of all of us, because we all look at everything from a different training point of view, but we come into the center and start to really understand each other and understand the field much better. It's a very exciting time. Now, this slide is from a book by rock musician turned neuroscientist, Dr. Daniel Levitin. It's called This Is Your Brain on Music, which I recommend very highly. It's easy to read. And this is a very busy slide, but it's because it underscores how busy our brains are. I just want to show you a couple of things on it. I'll use this pointer. The auditory cortex is where the music comes in, and it's processed, but it goes up to the prefrontal cortex, which is in charge of executive function. So when I was trying to not be too nervous to play that music, I was thinking, okay, here comes the 16th notes, here comes these other notes, don't play that out of tune, make sure that your fingers are, and how is your rhythm going? And so all of these thoughts are going through our heads. That's what the prefrontal cortex is sort of helping me to do. Meanwhile, you're listening, and the prefrontal cortex is saying, okay, where is she going harmonically with this? Is that note going to be going into another G major chord? You're not knowing that necessarily unless you're musically trained, but somewhere in your brain, you have expectations of the way a song is supposed to go. So if I was singing dun da dun da 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 dun dun da dun da da dun dun da dun da 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 dum bum bum ba da dum, you expected a note to go higher, and that's what your prefrontal cortex is doing. So it's managing your expectations. Let's see, where else? This is the limbic system down here. This is the frog part of your brain. It's the deepest, oldest part of your brain. So that's where our deepest emotions are. So the music that means the most to you, the music that helped Bill fall asleep for his surgery, the music that your grandmother still sings, even when she's forgotten how to sing new songs, that's all there in the limbic system. Meanwhile, over at the corpus callosum, the cerebellum down here, this is your rhythm section. It coordinates walking in rhythm or balancing things so that you don't fall over. It's your balance system, but it's also your rhythm section. And so when you hear music that you love, you can't help but tap your foot, snap your fingers, and that's thanks to your cerebellum. And connecting all of it from the left and the right is the corpus callosum. So that's the information superhighway. And we're finding that playing music helps to strengthen the connections between the left and right parts of the brain through this corpus callosum. So our neuroscientist friends tell us that it's not that music makes you smarter, but it's creating more neural connections. It's as if we have more on and off ramps on the information superhighway. With this in mind, it's not a surprise that the scientists are also beginning to find that you can tell the difference between a musician's brain and a non-musician's brain. There's just more stuff going on. So let's think for a moment about how we can use this clinically. What happens when you're playing music or when you're learning music? All of these things are going on. And this is something that Mariel was also referring to. You know, as we're learning, as kids are learning, they don't separate out like, I'm now going to do my music, I'm now going to do my math. Their brains are growing all the time, and the more things that we can help them do by connecting everything, the better. So what happens clinically? For language acquisition, for example, there's research being done for kids with dyslexia and also with autism. And music is helping children hear more specifically subtle sounds, like the sound between an F and an F sharp. It's a very subtle change, but it makes the difference between a sad song and a happy song. Children who are learning piano, who have dyslexia, we're beginning to see that they can distinguish between a B sound or a D sound, or the really subtle sounds that make all the difference in the world when you're trying to read or when you're trying to read silently to yourself and hear those small differences. What else? Well, I had referred to memory in patients with Alzheimer's and dementia. The songs that they had in their childhoods and in their teenage years where the emotions were deepest, those songs will still be in their memories when they're much older. I remember playing at a senior center, and when I asked the music therapist, what should we play? They said, well, you can play Mozart and you can play Haydn, but can you bring some musicals and some music from the 40s? And so we started playing On the Streets Where You Live from My Fair Lady, and the entire audience stood up and started belting out the song, word for word. And later on, the music therapist said, you know, there are some people in this room who no longer can speak, but they can sing every single word verbatim. And that's how deeply music is in our brains. As far as movement and motor planning, I talked about the cerebellum a little bit. Well, it turns out that people with Parkinson's, when they are dancing or when they have iPods on then they're listening to music, they can walk in rhythm, or they can move much more smoothly than they could when they're not listening to music. And so there are programs such as Dance for PD in New York with the Mark Morris Dance Company that are working on this and studying it. And again, integrative medicine is the way we need to be going, not alternative medicine. This should be part of the way we care for all patients with neurologic disorders. Let's move on to think about how music can heal the musician/physician. So my world has been blessed by being in the Boston area. I was a musician since I was 3, and I started playing the piano when I was 3, pretty much before I could talk much, and then I learned the violin later on. But I was thrilled when I got to Boston to find that there was a whole community of other people who had started their music when they were small kids, and they grew up to be scientists and doctors. And I think the work that Mariel is doing is beginning to give us some real validation of why this is. It's not an accident that doctors and scientists played piano for 10 years or something like that. It's because we've established new connections in our brain, and now we're using them in different ways. So the Longwood Symphony is a doctor's orchestra, but there's also music therapists, occupational therapists, physical therapists, nurses, medical students in this group. We play 4 concerts a year in Boston, as well as a big public concert out on the Esplanade every summer. And then we play chamber music concerts in the nursing homes and hospitals every month. Sometimes people say, well, how is it that you can have the time, and aren't you exhausted? And why would this be the thing you do after a long day's work? But now, knowing what we do about how we can use nonverbal ways of expressing ourselves through the arts to express things that we couldn't otherwise say to each other, it totally makes sense. So some of my colleagues come directly from tragedies in the emergency room or from long surgeries. And then we have a 3-hour rehearsal. But together, we're seeking out how, as a group of 80 people, we can find the harmonies in Brahms and Beethoven. Non-verbally, they're processing what happened to them in the emergency room or what losses that they had to share with families that day. And another interesting thing is, this is a list of the hospitals that are represented in our orchestra. So there are very few opportunities for doctors in competing hospitals to sit next to each other and play in harmony. And also, it completely disrupts the usual hierarchy. Ooh. Lost my slide. But the usual hierarchy of medical student versus attending, in this case, sometimes the medical student is the principal oboe and the attending is the third oboe. Well, there's another thing about the work that we do, and I mentioned Dr. Albert Schweitzer. So Schweitzer was an organist and a theologian. He was a pastor. But then he heard about the healthcare disparities going on in Africa, and at the age of 30, he went to medical school, and he decided that he would start a hospital. So at the age of 38, he and his wife, who became a nurse, moved to Africa and started the Albert Schweitzer Hospital in Gabon. I think there was an earlier slide and I was lucky enough to go there 2 years ago to celebrate the 100th anniversary of the Albert Schweitzer Hospital. So I snuck my violin on the plane and played for the kids. But what Schweitzer said, thank you. He said, "One thing I know is the only ones among you who will be truly happy are those who have sought and found a way to serve." And so that's what changed the Longwood Symphony. We already were finding that we loved playing in orchestra together. It was healing us, but it wasn't enough. What was important was to try and expand that and heal the community as well. So every concert that we play is to raise awareness about a public health issue and to help another organization. So let me just share just one example of what's coming up. We're opening our season in October with internationally recognized pianist Nobuyuki Tsujiii from Japan. He was blind from birth, but then he stunned the world by winning the 2009 Van Cliburn competition. He's now 26, and he actually also plays many concerts to heal others. And so this concert is actually going to be a benefit for the Boston Higashi School, which is a school for children with autism, and many of them are visually impaired, but also for the children of Fukushima who are in a symphony there. These are the children who lost parents from the earthquake tsunami, and Nobu has actually gone there and composed some music for them, so he will be playing with us. So in my last few minutes, I just wanted to share a sort of quick slides of different examples, other examples of how music is being used to heal in the way that Sachs says, where music is really just part of being human. In Venezuela, there is a program called El Sistema. It's now 40 years old, and it was started in the barrios of Venezuela to help children rise above their poverty. It's not to solve their poverty, but they all start orchestral music programs at an incredibly high level. So there are about 500,000 kids involved. But what really interested me, I was already passionate about that because of my interest in music education. But now they've expanded this to hospitals where children who have cancer or cardiac diseases who are sitting in the hospital for long periods of time are now given instruments. So these kids, when they're waiting to heal from their cardiac surgery or waiting for their chemotherapy, are practicing. Also in Venezuela is the White Hands Chorus. These are children who are deaf, and they wear the gloves so that you can see their signs. They're standing right next to children all the way over here. This is a choir of blind children, and the children sing in such perfect four-part harmony that as soon as they start singing, you just start tearing up. In the South Shore of Massachusetts, the Linden Ponds Chorus is a chorus of half people with Alzheimer's and half senior citizens who are living there, and you can't tell when they're singing which one is which. And here in Washington, the Remarkable Music Corps program that's run by Arthur Bloom, it enables wounded warriors to continue and to learn musical instruments. And in some situations, they actually modify the prosthetic so that you can see his index finger can play the bass notes. So Arthur does these kinds of things to really enhance their musical program. But these are musicians, and they see themselves as that. They practice 8 or 10 hours a day, and they have a band. They've actually performed for the president. They performed with Yo-Yo Ma. But it's a wonderful program here. And back in Boston again, Shelter Music is a way to engage people who are homeless in participating and listening to music. Julie Levin, the violinist, comes to different shelters every month, and she asks them, what did you think of the music? Did you like that Vivaldi? Should I play that again? And it's empowering to these people who we walk by every day on the streets and see, and they're invisible. For them to be asked their opinions, it has been doing wonders for engagement, and it's an incredible program. There are programs like that across the country. So these are just a couple of the programs where music has been healing, and so I invite you to think about or share with us later the kinds of programs that you are using in healing your own community. So I'd like to just close with one more piece by Bach. It's amazing how a single piece of music that was written 300 years ago can still touch our hearts. This is the Courante.
Thank you.